Today was an important day because here, sitting in this room, we have part of Europe, a small EU sitting here. So we did learn about different experiences. We did have the opportunity to exchange between different countries, and we're always, proud of bringing up this point, that point, or saying that no, on the opposite, in my country we don't do that, but maybe we should because I see that in your country it works well. And that's what being together and working together is about. I hope you will all bring at least one small detail back home that will change your daily work. And there were many of these details today. I cannot summarize them all, but there were many of them. We are also doctors from different fields. Even if we do obstetrics is very wide. I don't do gynecology anymore, so each time I learn something new in gynecology, it's very easy for me to learn something new in gynecology. I love listening to the neonatologists giving their point of view, and that's where we see that we need more time to work together. To give you an example, when the neonatologists explain to us something that is extremely important for the babies, that the babies have to deliver in the correct place to be cared for correctly and have a better outcome, us obstetrician, we have to cope with what we have figures in Paris, for example, 70% of the in utero transfer for treating preterm labor are discharged before being delivered. You get me? So 70% are useless transfers. That's a lot. That's a lot of money, a lot of energy, a lot of phone calls, copying medical notes. It keeps us very busy for a value that is, of course, important, but we're not very good yet at deciding who will benefit from it. So yes, the babies have to be delivered in the correct place, but it's going to be at great cost and a lot of false positive in the way we work, us obstetricians. It's not you neonatologists, but it's us obstetricians. And that's a big challenge for us. We learned that you should, we learned, for those of you who didn't know, but we should breastfeed for at least 4 months, and that's a major public health issue. But what was interesting is that after that, you have to press on it first.
You really are in control.
Yeah. But what was interesting, because the duration of maternal leave is different from one country to another, and then after these 4 months, it should be an option, and the woman should be able to choose and not be forced to be on maternal leave. But she should be able to choose and have the capacities and the financial capacities to choose. And that was also a very big message for the patient to bring home, I believe. Preeclampsia. That was very. The issue of preeclampsia is the issue of the egg and the hen, or the chicken. Is do you have a bad outcome later in life because you did a preeclampsia, or are you programmed genetically or epigenetically to have a bad health later in life, and then therefore when you will be pregnant, you will have a preeclampsia. Nevertheless, obviously we have to try to prevent and care for preeclamptic women, but it doesn't mean preeclampsia is not might not be the cause of what happens later in life, but might be just one of the symptoms of these women who are predestined to have complicated life issues, health issues later in life. We moved a bit further to the perineum, and it's always a disaster when we hear professionals talk about perineum after birth, and it always complicates antenatal care and the discussion with patient on antenatal care and the discussion with patient after they deliver, and they complain, and when we have specialists tell us about their job and how much they invest time and energy and how bad we are in discussing perineal issues in the postpartum, it just enhances the importance of, as a team when we work, to have some people who are specialized in perineal issues so we can address them, because even if we deliver the patient, we're not the ones who, we cannot spend so much energy on dealing with perineum afterwards. And women need to be cared for. And for those of you who do obstetrics, we all need a referral perinatal specialist as a referral doctor. And I'm lucky to have to work with such colleagues. And it's always terrible to see to what extent they have to develop care, develop some special treatments for these patients who have complaints. And it's important also to remember that when you don't ask the question, you will never know how much symptoms they have. We have to learn to ask the questions and then to refer to doctors who are specialists. Let's move on. The 1,000 days, for those of you who were not aware of that program, that's a fantastic program. And early investments are the best investments. We all know that, but we can see that some developments are being made on a greater scale, on a scale of some regions, some insurances, and maybe some countries. We're all waiting to see. And then we learned that the Japanese women are careful with their weight during pregnancy and after pregnancy. And maybe as a proxy of how careful they are with their weight during all these processes, they live longer. That's not to say that the only way of living younger, would you want to live longer, is to care for your weight, but it seems to be one of the ideas. I don't know if you know, but there's a very big message at the moment that is being circulated, is that we know that women live longer than men, but the difference between life expectancy and good life expectancy, good health life expectancy, is the difference is greater in women. I don't know if I'm making myself clear. It's not because they have more years at the end of their life where they're not in good health, the woman compared to the man. And there are, because there are menopause issue, there are cancer issue, there are all different issues. So, okay, they live longer, but they will spend more years in bad health than men. And that is, I was at the EU Parliament on a conference on women's health, and there were some pressure groups and lobby groups to push governments and institutions to do more research on quality of life and that difference in quality of life at the end of life, saying we should not be proud of women living longer if they spend more years not being healthy. So that life expectancy is not the end point. We should go further and look further into that and try to see and try to have actions that, okay, let's all live longer, but let's stay healthy as long as we can. And that time between not being healthy and death, maybe let's try to keep it as short as possible. We all agree, nobody knows how to do this, but we all agree. Well, I still don't understand the influence, the placental function, but that's they're great jobs doing that, but this is still a mystery. And finally, we have to go and open the doors of mental health during pregnancy. And there's nothing as precious as listening to a neighbor. So Belgium is a neighbor of France. Well, Flemish Belgium is a bit further away, but and it's always a pleasure to hear how neighbors try to find solution and how we can change things. We try to put a score on domestic violence in my hospital on a systematic score, the 4 questions on domestic violence in antenatal care in my department, and the professionals were just against. They said this is too complicated, we cannot ask 4 extra questions. It's not the 4 extra questions and it's not the time, it's people who are not ready to ask the questions. So we did, yeah.
I think it's not the questions, it's
No.
getting sensitive for the problem. The screening protocol doesn't really matter, but it's the sensitivity.
I totally agree with you. Even 10 is not a lot. I mean, it's not the number of questions, it's how ready you are as a professional to go and open that door and tackle the issue and get negative answers. I mean, how ready you are to hear a woman say that her life is hell, And thanks for asking. Now I have to tell you that I'm ready to commit suicide since you asked me. You have to know how to tackle this, and please show us examples. Please, if you have local examples in your hospitals and your institution, come and present, come and give us the tools and tell us how you helped your team move that way. So I think that, as I said, we put one question, domestic violence. People are getting used to it. I think the next step is coming to longer questions, and one to 4 questions. I think that they're going to survive and cope with that. But you can see that people were not ready a few years ago. Now they're ready. And what will be the future? I mean, it's for you to imagine what can be the future. And our antenatal care is being focused more and more from core health issues, because we tackle them correctly, better. We organize, we structure on basic health. I mean, we all take blood pressure, we wait. Well, it depends on the country. Some countries don't want to weigh the patients every month, but we still weigh the patients. And then we go into more details. And obviously, the huge field that is left for us to tackle is psychiatry, but it's also social issues, social matters. We didn't talk much about the migrant crisis at the moment, but in most of our countries, it's a major issue. In my hospital, well, in Paris, they decided that no woman, no mother of young children or pregnant woman should sleep outside, should be homeless. So we have to have them in my hospital and in our hospitals, and that means that at night our waiting rooms are full of homeless women sleeping. So, okay, they're sleeping inside, but we certainly didn't find a solution for them. But they're not sleeping outside, but they don't have a roof. So we need to tackle this one step at a time. We were not ready for social issues 20 years ago. We were not ready for psychiatric issues 20 years ago. Now we're getting ready, and these are the fields that have to be explored from my point of view. Quality of life and social issues. Now, I spoke a lot. I didn't do much today, just listened. But do you have any comments, or any speaker wants to add something?
Or some of the young students, residents?
No. Who are the residents here?
Or students.
Or students, yeah.
What do you look? How do you look
Okay,
in the future?
so what can each of the students give me one point that you're going to bring back? Just
Yes.
one thing that you will tell your friends maybe at a party when you're not too much. What is one point you're going to bring back? Nah, it's okay.
No, it's okay. I got very inspired today. I'm a resident in gynecology and obstetrics from the Netherlands originally. I'm doing my residency in Berlin, which is somewhat difficult sometimes, but also very refreshing and interesting. And I'm very happy to hear so many people from here who are also working in the field of fetal programming and because in the Netherlands we organize everything perfectly, really, too perfectly sometimes, I think. Well, what I'm going to bring home is this inspiration, and I would like to bring some things that I think are good in the Netherlands, maybe to develop also here.
Okay.
Which should be, in my opinion, to really identify the women and the children at risk for all those cardiovascular diseases after pregnancy or during pregnancy.
Yeah.
Because we know that the risks are there, but I think it's not possible to help all of those, or we have to identify the people and the children at risk.
And remember, once you identify them, if you don't do something immediately, it's too late later, or it costs too much. Right. Thank you. Behind?
So I'm Jana Maul. I'm still a medical student. I'm 5th semester now. I did my pre-clinics in Riga. And now I'm living in Dresden since approximately 2 months. And yeah, for me it's quite difficult to specifically say which specific topic I'll take home, because there were so many interesting presentations today. Also, I did not get everything because I'm not so far still, but in general, well, I found the whole day today very inspiring, and yes.
No.
That's it, yeah.
I understand that, I mean, for us, we enjoyed how technical it got. So I can understand that if you're not that far, it can be difficult. Other than
But still,
these,
I got something, so that's, and yeah.
and you had some very, very good experts
Yes.
tackling some difficult points. Your neighbor?
I'm Susanne. I'm studying in Marburg, but I'm in the last year of med school. I'm working in hospital in the practical year right now. And I would tell my friends to just listen and sing lullabies to your children. Because I myself thought, I can remember one song my dad always sang to me, and I can remember one song my mom always sang to me. And I think it's really important for the connection to the child.
Well, thank you very much. Not to be a party pooper, but we know that a lot of our very early childhood memories are false. That's okay. That's okay. They don't have to be true.
But that's the nice thing about it.
Yeah, they don't have to be true.
But there was one lullaby my dad sang, and when he just likes to sing, he's from Iran.
So he continues.
He sometimes gives concerts, and when he sings this song, I just get sleepy because it was my lullaby.
Let's take it as a positive point.
I'm Julia Schubert. I'm a medical student in 10th semester in Marburg as well. And unfortunately, I missed the first half of the day because I was still at the other congress. But what really
I
stuck...
just summarized it, you know.
Yeah, I know. But what really stuck with me, because I could visually imagine it, was that image of mothers in the intensive care unit singing to their children, because it was at the same time unusual and in my mind felt kind of out of place, but still beautiful, because I could imagine like how it would affect not only the children but also the bond between mother and child in a positive way. But it doesn't fit with my image of an intensive care unit, because I haven't been there many times. It's been like 2 or 3 times, and to me it was an environment where singing didn't fit, but still the situation of a mother getting to know her child singing fits perfectly. So that's what I will remember.
Yeah, that's. I was very marked by a testimony of a mother who delivered in another country. I won't tell the name of the country. She was from. I think she lived in Switzerland, but she did not deliver in Switzerland. And that was some years ago, not too long ago, about 10 years. And her baby was in intensive care, and that in that other country, which is a European country, she was allowed 20 minutes per day with her baby in intensive care. That's it. And she had to wait at the door, ring, then whenever someone would hear the ring, they would come and open the door, and 20 minutes later she had to be out. That's where we're coming from. And luckily, you know, you're talking about singing lullabies in intensive care. You see that huge path that has been that we have walked through, and I think the future is going to be even better, because we are opening the doors of these units to parents, in some places to families. It's very restrictive in France. But, I don't know if families can go in intensive care as a whole family. They can. Well, they can't in France, you see, and we're struggling with that. But they can as a family. That's fantastic. You see, we have to bring these things, these details, and bring them home. Of course, I'm not a neonatologist, so when I tell this to the neonatologists, they're not happy. They say, oh, "Okay, you don't care for them." So, but still, who else raised their hands? You didn't raise your hand. No. You raise your hand, but you don't want to talk. Okay. You raise your hand.
Yes, I
You're ready to talk.
You were asking about residents and students. So actually, technically, I'm still resident of Jacky from Poland.
Okay.
if something I will memorize this, from this meeting is especially this pelvic organ disease risk factors that we should avoid. Maybe we should be really careful in posterior occiput presentation during delivery, and especially in in more than 30 years old patient, and maybe we should think about C-section in those kind of patients, and we should really think about this pelvic organ disease during delivery and labor, because I think we frequently don't think about. We think about fetus during during the delivery and labor to prevent fetal distress, and we don't. We need to remember also about this pelvic prolapse.
And care for them, and not just say, well, it's normal, it's just delivered.
Yes.
No, that's what we used to say. Okay. Yes, please.
So, I'm not from the field, I mean, I work in the field, but I'm a product designer, so I got maybe 20% from what I heard today. It was a lot, but it was, for me, mind-blowing, especially as a man, I think, to hear these issues, that no one talks about them, and there's some really important issues, for example, woman health versus baby health. Or delivering before 20, which is the best time, and fulfilling yourself, so you shouldn't have babies before 30. And these topics, they are all around me, but it's very hard. As men, you don't talk about it with other men, and also when I talk about it with women, it's like when I say products, no one knows what is it. So I think, how can we bring this to the public, that there's more conversation about it?
So I've got a tough question for you. I apologize before. What do you think should be the influence on men in our society for women to have babies earlier?
To talk with them about it. I think this is what we need to do. It's like to start a conversation.
Because that's a major issue everywhere. I was telling at lunchtime, I was discussing with some of you, and I was giving that example of that woman, 43 years old, single, and she said, well, I'm going to have a baby now, and then I will find a boyfriend. I can no longer do it the other way, considering my age. So, and this is our society, and our societies are changing now, and I don't know why, but I get more and more of these patients who are coming with that state of mind. I care for their pregnancy, so I'm not the one helping them to be pregnant. But they're coming with this state of mind, and they say, that's it. I gave up the idea of finding someone, a partner, and creating a family. I'm going to create a family, and then eventually have a partner. And that is just completely changing our field. Yes?
I think it's important for the man to support the woman and to tell her that life isn't over after babies, after having babies.
Yes.
So that she will have the babies earlier, and also that she can still make a career. You know, that's also the issue. Lots of people just want to become Facharzt and Oberarzt, and then they decide, now it's time to have a baby, but then I'm already 41 and I don't know, it's not working out so well. So it would be really cool also if society supports women in that way too.
But that's the point. It's a societal issue. It's not a single woman by herself issue. And that's where we're not very good, because to my knowledge, no society has tackled it. It remains something that a woman deals by herself, or ideally with her partner, but not as a society.
But the proof of this is that in our residency course, 80% are women, and they know these problems. So we have to regulate the time they get pregnant. Otherwise, we get rid of all
Be careful when you say we have to regulate.
It's
a touchy subject.
We're talking about during residency course, most of our residents, the she residents, they get pregnant. So they have 1 year leave, then they come back, and then they start career, as she was saying. During 5 years of residency.
We were struggling.
They have evidence that we have problems later in life, so they get pregnant during the residency course. It's a good option. It's a good option.
Because we were struggling with our institutions, we were trying to tell them, considering the demography, 80% women. In first year of medical school, there's 70% women, and in some specialties, it's almost 100% women. And we say we told our governments we need 20% more doctors because of that, but that's a lot of money for them, and they're not ready to pay for that. That's a cost. That's a switch in our society and in demography, and having mostly women we need more doctors. And that's a good point. The male doctors are also changing the way they're working. They're taking more time. Legislations are changing in countries. The duration of you said paternity leave, is improving or extending. So that's also changing. And when they work at night, both women and men go back home after. So it's not like the girls go home and the men stay and still work. Everybody goes home. So people are improving, and I sincerely hope it's going to improve the quality of life. Although there's no direct relationship between the time you work and quality of life. Huh? Yes?
I'm sorry, the well-being of people is going down.
I'm sorry, what did you say?
The well-being,
Yes.
psychological well-being is going down. We have numbers in Belgium from 2004 to 2013, although the welfare is going up, the well-being is going down. And we think that a lot of people see pregnancy also as a project. They have to succeed in that, they have to do it very well, and they put themselves a lot of pressure on it. And it has to go like they want it to be, and if it's goes differently, they stress out.
Happiness is the difference between what you expect and what you have sometimes. And regardless of what the absolute value is. People are healthier, they live longer, they're less sick, they work less, they have more leisure time, and yet we have this subjective pressure and they're not
But
happy.
you always have to succeed, you have to combine everything.
They work less. Where is a place where they work less? I don't
People work less.
Yes.
Yes, please.
I'd like to say something before we get to maybe a political and negative touch. I go to a lot of conferences. You can go to a lot of conferences, and but you need to come here to have this high concentration of really excellent talks. Probably I never experienced in my whole life that high concentration. This is due to Bina. No, of course.
No, it's because it's your
Put all
birthday,
these people together. Put all these people together in one little room in your villa, and it's a very strange way to celebrate one's birthday. Yeah, it just shows how dedicated you are to the whole field, and that you dedicate your whole life to these projects. And so, thank you very much for putting us together.